Could your favorite drink be silently increasing your risk of a stroke? From sugary sodas to energy drinks and alcohol, certain beverages have been linked to cardiovascular damage and heightened stroke risk. Let's uncover what you need to know to stay safe and healthy. Strokes occur when blood flow to the brain is interrupted, either by a clot, ischemic stroke, or bleeding, hemorrhagic stroke. While genetics, lifestyle, and medical conditions like high blood pressure and diabetes are well-known contributors, the impact of certain beverages on stroke risk is often underestimated. Understanding this connection is crucial for prevention. Some drinks, particularly those high in sugar, caffeine, or alcohol, can significantly affect cardiovascular health. For example, sugary beverages like sodas or energy drinks can lead to weight gain, insulin resistance, and type 2 diabetes. These conditions are strongly linked to increased blood pressure and cholesterol levels, two key stroke risk factors. Similarly, beverages high in caffeine, when consumed in excess, may cause a temporary spike in blood pressure and, in susceptible individuals, lead to arrhythmias, irregular heartbeats that can raise the risk of blood clots forming and traveling to the brain. Dehydration is another critical factor that's often overlooked. Insufficient fluid intake can thicken the blood, increasing the likelihood of clot formation. Certain beverages, like those containing alcohol, act as diuretics, which means they can dehydrate the body even as they are consumed. Heavy or binge drinking also directly damages blood vessels and can lead to atrial fibrillation, a major contributor to stroke. Furthermore, many of these beverages contribute to oxidative stress and inflammation in the body, damaging blood vessels over time. This damage can make arteries more susceptible to plaque buildup, eventually leading to atherosclerosis, a condition where narrowed arteries impede blood flow, heightening stroke risk. To minimize the risk, awareness is key. Identifying which drinks pose a danger and moderating their consumption are effective first steps in protecting your brain and heart health. Small changes in daily habits, like switching sugary drinks for water or herbal tea, can make a significant difference over time. Sugary drinks, including sodas, sweetened teas, and energy beverages, are a staple for many, but their impact on cardiovascular health is alarming. Regular consumption of these drinks has been strongly linked to obesity, type 2 diabetes, and high blood pressure, each of which significantly increases the risk of stroke. When you drink beverages loaded with sugar, your body quickly absorbs the glucose, causing a rapid spike in blood sugar levels. Over time, this repeated sugar surge can lead to insulin resistance, a precursor to diabetes. Elevated blood sugar levels also harm blood vessels by increasing oxidative stress and inflammation, which weakens arterial walls and promotes plaque formation. These changes increase the likelihood of blockages, making ischemic strokes more likely. Additionally, sugary drinks contribute to weight gain, particularly visceral fat, the fat stored around abdominal organs. This type of fat is especially harmful as it produces inflammatory molecules that further compromise cardiovascular health. Research has shown that people who consume one or more sugary beverages daily have a higher risk of developing hypertension, a leading cause of stroke. A lesser-known consequence of sugary drink consumption is its effect on blood lipids. These beverages can raise levels of triglycerides, a type of fat in the blood, and lower HDL cholesterol, the good cholesterol that helps remove excess fat from arteries. This imbalance accelerates atherosclerosis, narrowing blood vessels and restricting blood flow to the brain. One of the most concerning aspects of sugary beverages is how easily they contribute to excessive calorie intake. These drinks lack satiety, meaning they don't make you feel full, and they're often consumed in large quantities without replacing other calorie sources. This leads to a higher overall caloric intake, fueling weight gain and its associated health risks. Reducing or eliminating sugary drinks from your diet can have immediate benefits. Opting for water, unsweetened tea, or naturally flavored seltzer are excellent alternatives that support hydration without the added risks. Awareness and moderation can be powerful tools in protecting your cardiovascular system from the harm sugary drinks can cause. Caffeine is a widely consumed stimulant, found in coffee, tea, and many energy drinks. While moderate caffeine intake is generally safe, excessive consumption, particularly from energy drinks, can have dangerous effects on cardiovascular health and increase the risk of stroke. Energy drinks, in particular, pose a significant risk due to their high caffeine content combined with added sugars and other stimulants. Consuming these drinks in large quantities can cause a sudden spike in blood pressure, a critical factor in stroke risk. For individuals with underlying health conditions, such as hypertension or heart disease, this effect can be even more pronounced. In addition to raising blood pressure, excessive caffeine can lead to heart palpitations and arrhythmias. Irregular heart rhythms increase the chance of blood clots forming in the heart, which can then travel to the brain and block blood flow, resulting in a stroke. The combination of caffeine with other stimulants commonly found in energy drinks, such as taurine or guarana, amplifies these risks by overstimulating the nervous system and cardiovascular system. Another concern is how energy drinks may affect hydration and blood viscosity. Many of these beverages act as mild diuretics, which can lead to dehydration if consumed in excess. Dehydration thickens the blood, making it more prone to clotting, and further elevating the likelihood of a stroke. People often underestimate how quickly they can exceed safe caffeine limits when consuming energy drinks, especially when combined with other sources like coffee or soda. Symptoms of overconsumption, such as restlessness, rapid heartbeat, and dizziness, should never be ignored, as they could signal an impending health issue. Minimizing or avoiding energy drinks is a crucial step in reducing stroke risk. 4. Those seeking an energy boost, healthier alternatives include drinking water, eating nutrient-rich snacks, or opting for moderate amounts of unsweetened coffee or tea. These choices provide a safer and more sustainable way to maintain focus and energy without jeopardizing cardiovascular health. Alcohol is a widely consumed beverage that, when taken in moderation, may offer certain health benefits. However, excessive or irresponsible drinking significantly increases the risk of stroke and other cardiovascular complications. Understanding the fine line between moderate and harmful consumption is essential for safeguarding brain health. Alcohol impacts stroke risk in several ways. Heavy or binge drinking can raise blood pressure to dangerously high levels, one of the leading causes of stroke. Chronic excessive alcohol use is also associated with atrial fibrillation, an irregular heart rhythm that can cause blood clots to form in the heart. These clots can travel to the brain, leading to an ischemic stroke. Additionally, heavy alcohol intake contributes to liver damage, which interferes with the production of proteins necessary for proper blood clotting. This can increase the likelihood of hemorrhagic stroke, where bleeding occurs in the brain due to weakened blood vessels. Alcohol-induced dehydration further compounds these risks by thickening the blood, making clots more likely to form. Even moderate drinking carries potential risks if not approached with caution. For instance, consuming alcohol alongside other unhealthy habits, such as smoking or a poor diet, can amplify its negative effects. Moreover, some individuals have genetic or health conditions that make them more sensitive to alcohol's impact, increasing their risk of complications even with light consumption. On the other hand, moderate alcohol consumption, defined as up to 1 drink per day for women and up to 2 for men, has been associated with a slight reduction in the risk of certain cardiovascular conditions. However, the type of alcohol consumed matters. Red wine, for instance, contains antioxidants like resveratrol that may have protective effects, but these benefits do not outweigh the risks of overconsumption. For optimal brain and cardiovascular health, limiting alcohol intake or avoiding it entirely is a prudent choice. Staying hydrated, pairing alcohol with food, and avoiding binge drinking are key strategies for those who choose to drink. The focus should always be on moderation and understanding individual limits to reduce the likelihood of stroke and promote overall well-being. Preventing stroke begins with understanding how your beverage choices can impact your health and taking proactive steps to reduce the associated risks. Making mindful decisions about what you drink can significantly protect your brain and cardiovascular system. Start by prioritizing hydration with water, which helps maintain optimal blood flow and prevents dehydration, a condition that can thicken the blood and encourage clot formation. Replacing sugary drinks with water or unsweetened alternatives like herbal tea not only reduces your sugar intake but also lowers your risk of developing conditions like high blood pressure, diabetes, and obesity, major contributors to stroke. Limiting caffeine is another crucial step. While moderate amounts of coffee or tea are generally safe for most people, consuming too much caffeine, especially from energy drinks, can lead to elevated blood pressure and irregular heart rhythms. Gradually reduce your caffeine intake if you find yourself relying on it excessively, and consider healthier energy-boosting options like balanced meals, physical activity, or adequate sleep. When it comes to alcohol, moderation is key. Understanding your personal limits and adhering to recommended guidelines, up to 1 drink per day for women and 2 for men, can help mitigate the risks. Avoid binge drinking, as it can spike blood pressure and lead to other cardiovascular issues. Opting for alcohol-free days during the week can also support overall health. Reading beverage labels is an often overlooked but essential habit. Many seemingly harmless drinks, such as flavored waters or prepackaged teas, can contain hidden sugars, artificial additives, or excessive caffeine. Being informed about what you're consuming helps you make better choices that align with your health goals. Finally, regular checkups with your healthcare provider are vital for monitoring risk factors like blood pressure, cholesterol, and blood sugar levels. If you have a family history of stroke or cardiovascular conditions, discussing your lifestyle and dietary habits with your doctor can provide personalized strategies to mitigate risks. Adopting these habits creates a strong foundation for a healthier lifestyle and significantly lowers the chance of beverage-related stroke risks. Simple. Changes in daily routines can have long-term benefits for both brain and heart health.